probably know someone who is pregnant during this time, so let's talk to an expert. We are joined live by Dr. Adam Borgida, the Chief of Obstetrics and Gynecology at Hartford Hospital. Doctor, thank you very much for making the time for us today.
Thank you for having me.
So tell us basics. How can pregnant women protect themselves?
Yeah, I think pregnant women need to take the same precautions as anybody else that's out there right now. Frequent hand washing, cleaning counters frequently as well, and then, practicing social distancing, just like we'd recommend for someone who's not pregnant.
All right, what about scheduling and going to prenatal appointments? What should pregnant women do about that?
Yeah, I think, a lot of the offices are pre-screening women before they come in. If it's a routine visit and someone isn't feeling well, they need to talk to their doctor. But we're trying to space visits out and do exactly what's necessary. So I don't think people should be surprised if their doctors contact them ahead of time, and we're keeping the visits that are really needed.
Okay, are pregnant women more likely to become infected with COVID-19?
Yeah, we get this question all the time, and although there's not a lot of data out there yet, all the evidence has shown that it doesn't appear that it seems to be more common in pregnancy.
Okay, good to hear. And what about passing on COVID-19 to an unborn baby? What is the latest on that?
Yeah, that's another excellent question. There's a few series of pregnant women, and so far as we can tell, it doesn't appear that it's passed through the placenta to the baby, so babies are not born with this virus even if the mother is infected.
Okay. What should a pregnant woman do if she has a fever, cough, shortness of breath?
Yeah, I think if there's concerning symptoms like that, she definitely needs to contact her provider who's giving her OB care so they can decide whether she needs to contact a hotline, come in for a visit, or just stay at home if it's very mild.
Okay, let's talk about Hartford HealthCare. What are the current COVID-19 visitor restrictions as of today?
Yeah, as of today, we still allow one visitor with a pregnant mom so that when she comes in and has the birth of her baby, it's still a special experience. We want the family to be together. I know a lot of places in New York have had restrictions with no visitors, but for now, we're keeping that present.
Good to hear, good to hear. All right, some women choose doulas. Is a doula considered a visitor? Tell us about that.
Yeah, we have considered doulas visitors, and again, I know that's a great support person for some people, and they planned on it, but we're trying to do the safest thing for our patients, our staff, and we have to limit to one visitor at this time.
I know, we got to keep that staff healthy too. It's so important. All right, what about after a woman who has COVID-19 and gives birth? What can she expect from your health care?
Yeah, I think, we do take special precautions if we know a woman has this virus, and we have to protect her baby. So the current recommendations is the baby will be separated from the mom right after birth and get an early bath. And then while we're still trying to figure this out, we have to keep them separated.
And can a woman transmit COVID-19 through breastfeeding? That's another question we've gotten.
Yeah, we get that question a lot, and it does not appear that the breast milk contains this virus, so we do encourage breastfeeding. Now, we do have to take special precautions. First off, we like to have the mother pump and then a different healthcare worker provide the milk to the baby, or if the mother is going to breastfeed, we have to use some special precautions, having her wear a mask and be extra careful.
Wow, interesting. Okay, what if a woman is an essential employee? Should she stop working because of the virus and her pregnancy?
Yeah, we get this question all the time as well, and the current recommendation is that pregnant women should take the same precautions as anyone else. However, if we have a known COVID-positive patient, pregnant women should definitely avoid them.
All right, doctor, where can women get more information on all of this?
Yeah, we have a hotline, as you know, here at Hartford HealthCare. It's 860-972-8100. They can get a lot of information there, or go to our website. We have some online education and some peer support groups that are going virtual, like everything else these days.
A lot of good stuff online these days, right? All right, Dr. Borgida, thank you so much for joining us and giving us insight into these popular questions. We appreciate it.
Thank you very much.